and all the friends that are here for this occasion. I am Dr. Raul Ruiz. I'm a member of Congress, an emergency medicine physician, a public health expert, and above all, a father and a concerned American. Today, we are here to oppose the confirmation of Robert F. Kennedy Jr. to lead the U.S. Department of Health and Human Services, this building right behind us. Let me be clear. Robert F. Kennedy Jr.'s beliefs are a threat to public health and jeopardize the lives of millions of Americans. He has continuously promoted harmful, false healthcare claims that have already sown distrust in our public health institutions and in life-saving public health interventions. As doctors, we all know firsthand the devastating impact that misinformation can have. Vaccines, and let me say that again, vaccines are a cornerstone of public health. They save lives. They protect our children, our elderly, and those who are most vulnerable. Any rhetoric that erodes trust in vaccines threatens the very fabric of our most effective public health interventions that are scientifically proven to be safe. Before vaccines are made available to the public, they undergo a rigorous process to ensure their safety. This includes providing information to help individuals determine whether they should receive certain vaccines based on their personal health concerns or conditions. We are already seeing the consequences of misinformation. We've witnessed the alarming increases in preventable diseases. Measles outbreaks are on the rise. Polio is making a dangerous comeback, and whooping cough has increased fivefold. These are not hypothetical concerns. They are real, and they are happening now to real people. If Robert F. Kennedy Jr. were to lead the Department of Health and Human Services, I fear these alarming trends will only escalate. Doctors and public health experts have raised concerns about RFK Jr. and his organization's Children's Health Defense, which continuously publishes anti-vaccine content. This is a direct attack on the trust that millions of Americans place in our critical public health interventions, and it is threatening our ability to keep our own communities healthy. Attacking vaccines with misinformation makes America unhealthy again. I've dedicated my life to science and to ensuring that we make decisions based on scientific evidence. As the former ranking member of the Select Subcommittee on the Coronavirus Pandemic, I've seen up close how lives are lost and communities are harmed when science and facts are ignored. So I stand here ready to say this: the leadership of our public health agencies must be grounded in science, facts, and the well-being of every American. RFK Jr. has proven time and time again that he is not committed to these principles. His dangerous views on vaccines have already caused harm, and they will continue to do so if he is given control of the agency responsible for safeguarding our health. We cannot afford to let misinformation be the foundation of our public health policies. We must act now to protect our families, our communities, and our future. Thank you, and I would like to introduce my friend and colleague, Dr. Herb Conaway.
Good afternoon, everyone. RFK Jr. is not only inexperienced, but his rhetoric and misinformation that he has spread about vaccines has had deadly consequences. Because of his influence and family name, RFK Jr. traveled to American Samoa to exploit an already tragic situation involving a misapplication of a vaccine. It was not the vaccine that caused the problem. It was the misapplication of the vaccine that caused the problem. But what did RFK Jr. do? He went to American Samoa, met with leaders of that island nation, and spread misinformation about the vaccine itself. That caused the government to end their MMR vaccine, the vaccine against measles, mumps, and rubella. And the result was that 83 children, mostly children, died. Now, he needs to answer for that. In my view, he has blood on his hands. And it was only when the public health system responded and vaccinated 36,000 people on that island, the spread of that potentially preventable disease and potentially deadly disease was halted on that island. Misinformation is very dangerous to public health. I work in public health. It was one of my jobs before coming here to the Congress. I entered life in a public health department at the time that COVID was coming forward. Great time in Conway. It happens all the time. But we responded with testing, we responded with science, and we responded by getting a vaccine program against COVID up and running. We had the second mass vaccination program up and running in the state of New Jersey under my leadership at the county, and it saved lives. And all the while, we were answering questions about the safety of the vaccine and the effectiveness of the vaccine, and explained to people that while that vaccine was brought to bear against the problem, it stood on a foundation of 20 years or more of science and research on vaccines, the making of them, and the application of them in support of a public health mission. Information provided to the public that's science-based allows individuals to make decisions about their lives and their health care. And when they are lied to, when people spread false information about those vaccines, people then become vaccine hesitant. That means they delay the vaccines of their child. That means we have outbreaks of measles and the return of polio, where we had just about eliminated it. We can't have an irresponsible person like that who is prepared to spread falsehoods and misinformation, leading what should be the leading, and is, the leading healthcare agency in the world. We're seeing now an attack against the CDC and the scientists there. They're getting a pink slip here very shortly. What will that do to public health? So he needs to, our senators in the responsibility to confirm the heads of these major institutions, they need to do their job. They need to stand fast. They need to say no to RFK Jr. Let me bring forward my colleague, Maxine Dexter from the great state of Oregon.
Thank you so much, and thank you, Dr. Congressman Ruiz, for bringing us together here today, and to Dr. Conway. I am Maxine Dexter. I am very proud and honored to serve the 3rd Congressional District in Oregon. I am a pulmonary and critical care physician, and I believe very strongly that science-based decisions are the right way to make decisions. As the Democratic physicians of Congress, we are speaking in a unified voice to demand a government that is guided by data, science, and a commitment to the public's health. As a critical care physician in Oregon, we diagnosed my group the first case of COVID-19 in the state of Oregon. I did not put my life on the line, nor did any of the other teammates that I had, to then see erosion of vaccine confidence from a man whose job it is to protect the public's health. Robert F. Kennedy Jr. is gravely unfit to serve. He promotes dangerous and unfounded lies, including that vaccines cause autism. This has been debunked over and over again. He said in his confirmation hearings that SSRIs are more addictive than heroin. That is patently false. He also exhibits a concerning lack of understanding of key components of our healthcare system, like the difference between Medicaid and Medicare. He should not be our nation's Secretary of Health and Human Services. But his nomination is just one example of Trump's reckless approach to public health. Trump has unleashed chaos at the National Institutes of Health, freezing federal grant funding and injecting confusion into the approval process for scientific studies. I'm hearing from constituents whose livelihoods are at risk because Trump and his special government employee, Elon Musk, are decimating NIH jobs and grants. These medical professionals have put themselves at risk, waiting grant to grant to make a difference for our communities, and their whole careers are being undermined by these people. We will use every tactic available to fight back. And I hope that the public will stand up with us. We will be fighting in the courts, in the halls of Congress, and certainly in the public sphere. And we must stay loud. We must stand tight together against this administration's reckless abandon for public health, and we must press on together. Thank you so much. At this point, it is my privilege to hand it off to my friend and colleague, Dr. Congresswoman Kelly Morrison.
Good afternoon. I am Kelly Morrison, representative for Minnesota's 3rd District, and I have had the honor of caring for Minnesotans for more than 20 years as an OBGYN. While my colleagues have highlighted a number of concerning and frankly disqualifying issues with Robert F. Kennedy Jr.'s nomination, from promoting dangerous and unfounded mistrust in vaccines, to posing a threat to mental health care, to having a concerning lack of understanding of Medicaid and Medicare, which tens of millions of Americans in every state across the country rely on, I'm here to discuss the direct and dire threat that RFK Jr. poses to women's health. Let's start with the facts. In his confirmation hearing last week, RFK Jr. vowed to implement whatever position President Trump takes on regulating abortion pills, and he has already asked him to, quote, study the safety of mifepristone. Let me be very clear. Decades of research and clinical experience have demonstrated that mifepristone is safe. Its safety is undisputed by medical experts. For my entire career as an OBGYN, more than 20 years, doctors have been prescribing and patients have been taking mifepristone safely and routinely. No other safe and legal medication in America is being targeted like this medication is. We have to be clear-eyed about the threat before us. In his role as HHS Secretary, RFK Jr., at the direction of President Trump, could increase restrictions on the abortion pill. He could pull it from the U.S. market altogether, and he could end access to this safe and effective option, even in states where abortion is legal. Let's remember that about 90% of all abortions occur early in pregnancy, and more than half of those are medication abortions. Banning mifepristone would, for all practical purposes, create a national abortion ban. It's really difficult to overstate the threat this poses to women's health care. But RFK Jr. doesn't stop there in his attacks on women. As HHS Secretary, he would also make American women and girls less safe in terms of protecting them from cancer. Cervical cancer is the 4th most common cancer in women worldwide, but it is also one of the most preventable. It's truly one of the miracles of modern medicine. The HPV vaccine prevents almost all cancers caused by HPV, most notably cervical cancer. But once again, in direct opposition to scientific research and medical experts, RFK Jr. has played a leading role in undermining trust in the HPV vaccine by propagating misinformation about it. He has called it dangerous and defective and falsely claimed that it can actually increase the risk of cervical cancer. And he has helped facilitate and profited off of hundreds of lawsuits aimed at companies that manufacture the HPV vaccine. How could we ever have a Secretary of Health and Human Services who is attacking one of our most successful efforts to prevent cancer in women and girls? He says he wants to make America healthy again. This will only make America sicker. We should have a leader of HHS who is guided by science and evidence and who wants to promote the health and well-being of women, children, and families. As an OBGYN, I implore my colleagues in the Senate to not betray the women of this country, to not threaten their basic health care, and to oppose the nomination of RFK Jr. I now want to turn it over to a true champion for children and families who has spent her career as a pediatrician taking care of kids and is a strong advocate for the health and well-being of all Americans, Congresswoman Dr. Kim Schreier.
Thank you, Dr. Morrison. we might need an orthopedist if any of us fall on this pavement. I've had several conversations over the past week with senators, cautioning them that we need to do better when it comes to the health and safety of our country, and that they should vote down RFK Jr. for Secretary of Health and Human Services. He's just grossly unqualified. We can start with peddling conspiracy theories, having a track record of decades of being anti-vax. We can talk about a lack of experience, no medical background, and not respecting science or scientists. But I will tell you, as a pediatrician, his stance and continued questioning of the safety of vaccines that have been proven time and again to be safe and effective is so destructive to public health in this country. We've already seen measles outbreaks. We have several counties in Washington state right now with pertussis or whooping cough outbreaks. I've taken care of kids with both of these, and they are miserable. And in the case of pertussis, when a small baby gets this, they just stop breathing. And when adults get this, they cough for 6 weeks to the point where they are breaking ribs. And we cannot afford to have these infectious diseases come back. Kids will die if he is in this position. He continues to sow doubt and question safety of vaccines. If parents get worried and hesitant, and some of those parents choose to not vaccinate their children, who will then go to school with your children and potentially see their grandparents and get them sick. This is not an either-or proposition. We can have a Secretary of Health and Human Services who looks into food, wants healthy food, clean water, getting the additives out of what we eat, and brings us back to eating closer to the earth, and who will not undermine all of the progress that we have made in combating these vaccine-preventable diseases. We cannot afford to let measles come back, to let polio come back, and they will when vaccination rates drop. So I will continue to encourage the senators to please do the right thing. Do not let kids die. Do not let their grandparents die, and vote down this nomination of RFK Jr. I am so pleased now to introduce my colleague, Representative George Whitesides from California.
Good afternoon, everyone. It's an honor to be here with this incredible group of doctors who are speaking from the heart about a super important point. My name is George Whitesides. I have the honor of representing California's 27th congressional district. And while I've only held the position of congressman for a little bit over a month, I've spent my life pursuing science and technical research both on land and in space. It should not take a group of doctors or scientists or members of Congress to point out that the leader of our public health care system should believe in basic science. I join my many constituents who have reached out to share their concerns about RFK Jr. and express their extreme disappointment and fear over the slew of unqualified nominees we've seen over the past 2 weeks. It is genuinely terrifying to think of the harms that President Trump's cabinet could cause. But I want to focus on RFK Jr. and the risk that he would pose such a specific and targeted threat to the healthcare in the United States as we know it. As HHS Secretary, RFK Jr. would oversee the Food and Drug Administration, the National Institutes of Health, the Center for Disease Control and Prevention. He would control a staff of 80,000 people and over $1 trillion budget. He would be in charge of ensuring that what we eat is safe, that our medications are effective, and that we are curbing and curing diseases at home and around the world. President Trump has already ripped the United States out of the World Health Organization, making it more difficult to share information and research on global health challenges. And now, as we face new threats, including a resurgence of bird flu and other potential pandemics, it is imperative that the leader of our healthcare system grounds their decisions and their work in real science, not conspiracies. The bottom line is that RFK Jr. does not understand and does not believe in critical healthcare programs that millions of hardworking families rely on. Medicare, Medicaid, the Affordable Care Act, and the Children's Health Insurance Program are all at risk with him at the helm. The HHS Secretary has the potential to strengthen our healthcare system, to improve our ability to fight diseases, to cement American leadership, and to create a more equal and accessible healthcare opportunity for all. But if senators choose to confirm RFK Jr., they are threatening the lives of Americans in their home states and across the country. I urge my colleagues in the Senate to vote no on his confirmation for the well-being of millions of Americans across the country. And now I'd like to turn it over to my distinguished colleague, Representative McClelland, as the next speaker. Thank you.
Good afternoon. I am not a doctor. I am not a scientist. I'm a mother. I am a mother who nearly died giving birth to my daughter. I am a daughter who, as part of the sandwich generation, had to help care for, and watch two elderly parents pass on. I have seen the entire continuum of healthcare policy after nearly 20 years in elective office, first as a state legislator and now as a member of Congress. And we have worked too hard to eradicate disparities in healthcare that cause women, black women, to be 3 times more likely to die in childbirth, and black men to be more likely to die of cancer. We have worked too hard to overcome nearly a century of racist tropes in healthcare that said black people felt pain differently. We've worked too hard to address these disparities, to now have as the head of our healthcare system a man who has claimed we should not give black people the same vaccine schedule as is given to whites because their immune system is better than ours. Or who has said, if you are trying to immunize a white person, you need to give a certain amount of the measles virus to them, and for a black person, they'll get the same immune response if they get half that amount. Are you kidding me? We have disparities in our healthcare system, not because of fake genetic differences, but because the impact of over 300 years of slavery and Jim Crow put some communities out of reach of quality health care while others got the best. Because over 300 years of slavery and Jim Crow did not go away with the wave of a magic wand when the Civil Rights Act passed. And we had communities, black communities, that were literally cut off from healthy food, from jobs, from transportation, and quality health care by highways that cut their neighborhoods off and poured pollution into their neighborhoods. We have worked too hard to make sure that the Medicaid system, the Medicare system, the private health insurance system are not leaving any community behind. And we've certainly worked too hard for a man to profit off of the name of someone who would be appalled by some of the things that he is doing today. I'm not going to repeat all of the reasons my colleagues have said that this man, I can't even say his name, should not be the next Secretary of Health and Human Services. I am here on behalf of my daughter and my son, my parents, my grandparents, and my great-grandparents to say we will not continue to fight these fights, but if this man is in office, we will roll back decades of progress, and that's why the Senate must say no. It is now my pleasure to introduce my colleague from Hawaii, Jill Takuda.
Aloha, everyone. You know, I think it's fitting actually that we're having this press conference right here on these grounds, because literally every step you take, you feel like the next one is going to be a fall. And that's exactly the moment we are in right now. We are here to call on our Senate colleagues to find the courage in themselves to do the right thing. I am not a doctor, but I have been the beneficiary time and time again, as Jen said, of doctors who actually took the Hippocratic Oath, who believe it, who live it, who serve in Congress and fight for it. This is a man who is the antithesis, the absolute opposite of the Hippocratic Oath. He does harm. He is harmful. And as we have seen in the messages today, when healthcare lacks leadership, when all we have is lies, people die. People die. When I was in the Hawaii State Senate, I served with Governor Josh Green. And as you know, he was one of the doctors who went to Samoa. He held in his hands lives that were lost because of the lies of this man. We cannot have this be part of our American history. It cannot be a part of our Health and Human Services Department. I passed laws to align Hawaii's vaccination standard for our children, for our keiki, with federal standards. Why? Because that was and must continue to be the gold standard. With this man in charge, all we will see is lies. People will die. So I humbly ask my Senate colleagues to take a moment, turn around and look in your own homes. Look at your loved ones, look at your children, look at your grandparents, your spouses, your constituents, and ask yourselves in good conscience, can you take a Hippocratic Oath, do no harm, and vote for this liar? The answer is clear. We have a choice, people. The Senate must not confirm this man to lead us in a place that would only result in death. Thank you to all of my colleagues for being brave, for taking that oath and living it and meaning it and fighting for it in Congress. And we're here to tell you that our advocacy, our pushback will not stop no matter what happens. Mahalo.
Thank you. Thank you. And as you heard from doctors, scientists, mothers, legislatures, problem solvers, concerned citizens, we oppose the confirmation of RFK Jr. for the myriad of reasons. The most important is that it will lead to more unnecessary deaths from infections that could have been prevented from vaccines. And with that, I want to thank you all for your attendance. I want to thank the press that's here and those that are watching live through our live stream. Thank you very much.